Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Elucidating as well. But it also says that you speak Amharic. Is that right?
Oh no, I don't speak Amharic. No, that's on Howard's website. We have Amharic interpreters, but no, I'm not an Amharic.
Oh, really?
You can't believe everything you see on Google. I'm also a hematology specialist on Google. Because we have a hematology specialist at Dr. Rana in our clinic, they think that I'm a hematologist, but no, I'm not. I'm not a hematologist.
Oh, no, I didn't know. But no, but it said that you spoke Amharic, and
Correct.
I was surprised.
I do not. I do not.
But his other distinction is that he's on the board of directors of the American Board of Lifestyle Medicine, and has he and his wife has created their own lifestyle medicine revolution, emphasizing nutrition, exercise, spirituality, and group support. And so we are especially blessed today to have a unique person who's innovative, creative, and will educate us about a topic that we're all anxious to hear. So, David, thanks for joining us. I appreciate it.
Oh, no problem. My pleasure. Thanks for inviting me. I really was excited to talk to this group, and thank you so much for the invitation. All right, I'm going to go ahead and share my screen. And all right, so I'm going to talk today about lifestyle medicine for cancer and for chronic disease. We are dealing with this as Black people in way more than we probably should. And so I want to make sure that we discuss these issues together. We're going to discuss the problems of cancer and chronic diseases and discuss what lifestyle medicine is, why it works for cancer, and why it works for chronic diseases. So I had a fruit fly issue in my house last summer, and had a couple of fruit flies that kept nagging us all the time, and they kept getting in our all over our house. And but they're mainly focused in the kitchen, and we would spray them down and do things like that. And then one day we thought that we found the source of them because it's got a little thicker. Then we looked in our cabinet, and there was something that was rotted in the cabinet, like a potato that was rotted. So I was like, oh, that's the issue. Okay, take care of that potato. We're good now. We shouldn't have any more fruit flies. And for a week or so, no fruit flies. And then they started coming in mass. And then one day, it was all over the house. The entire wall in our basement was covered with fruit flies. And it was like, oh my gosh, what's going on here, right? Kind of find out, a month earlier, I had driven to Indianapolis and had a bag of bananas, and had forgot to bring them upstairs to eat them or to throw them away. And so those bananas were rotted, the fruit flies were expanding, and that we found out why our problem was there. And once we got rid of the bananas, and had to vacuum up all the fruit flies, because you can't just spray them. We just literally took a vacuum to them and killed them all. Finally, we dealt with it. Now, that being said, that's very similar to our health issues. So we start off and we got a couple health issues there, kind of a little nagging, and we deal with them a little bit, and we got a few more, and then we got one that seems like it's pretty big, and then we take care of that one, and all of a sudden, boom, we have one that is massive, and it completely changes our life. And that's how things go in our life. And I want to make sure that we think about that as our foundational thought process. So we in medicine, we do not get down to the underlying reason why we have the health problem. We just kind of just treat the effects of the health problem. Just like I was trying to use this vinegar and soap thing to try and catch some fruit flies, and I was trying to swat them away and do a couple things early and spray them. Uh, that wasn't enough because I hadn't gotten down to the actual reason why they're in my house. And once I got down to the actual reason why, then we can have better outcomes. So when we think about what factors affect health, let me ask you guys to come off mute and to ask, like, what are some of the factors that affect health?
The food you eat.
Food, absolutely.
Sleep.
Sleep.
How
Oh
much
my
sleep
gosh,
you get.
sleep is
Rest.
my new focus right now. Sleep is actually really important.
Mhm. Then you
Stress.
I'm not sure if you guys have stress, but yes, stress indeed is a big one. So here are a couple of things I thought about is genetics, epigenetics, culture, lifestyle factors, including our stress, our nutritional choices, our activity level, our sleep, our social connections, our obesity levels, the social influencers of health. They often call them the social determinants of health. I like to call them social influencers of health. They don't determine our health; they influence our health. Our finances, our psychology, our perspectives, all those things play a role in our health. So let's say we end up having hypertension. So with all of these things, our epigenetics, our genetics, our culture, et cetera, we end up having hypertension. Well, a lot of people have hypertension. It's kind of almost a natural thing. Most people get it when they get older. And it's just kind of a thing. Well, because good thing is we got medications that can treat the effects of high blood pressure, but they never address the causes of the high blood pressure. They just address the effects of the high blood pressure, those medications. If we're not careful, if we don't address those factors, then all of a sudden now go from high blood pressure, now we got diabetes. Now we have erectile dysfunction. And with the medications for those too, so try to treat those. But then things keep piling up and progressing. Like my fruit flies got worse and worse. They pile up and progress if we never address the underlying factors that lead into these problems. So it's really important that we address these underlying factors. But the underlying factors of the underlying factors really are oxidative stress and inflammation. Those are the core of all of our health problems. All of our chronic health problems have oxidative stress and inflammation as a core part of it. And then oxidative stress comes from psychological stress. Some of that's from just being Black in America. Some of that is from just, living life in America in general, as a person or as a woman or as whatever it is. And then it could be the oxidation from the food that we eat because we're not eating enough whole plant foods, not eating enough antioxidants. And then there's inflammation. We either consume too many things that are causing inflammation, like salt and processed foods and dairy, beef, chicken, eggs, sugar, or refined and white carbs. We eating too much of that and not eating enough anti-inflammatory foods and drinks. Then our diet is too low in fiber. Fiber helps to get rid of excess hormones. It helps us to lower our cholesterol. It helps our good gut bacteria, and the good gut bacteria will give us more anti-inflammatories. Inactivity, inadequate sleep quality or amount, obesity, taking in too many toxic substances, all those are underlying factors for all these health problems. So my own testimonial, back in 2014, I had years of health problems. My constipation was so bad, I had to have surgery. I had an anal fissure that led to an anal fistula. And I'm walking around having to put toilet paper in between my cheeks because I was leaking anal fluid.
Oh,
My indigestion
no.
was bad. Reflux was bad. My allergies, if I walked on the side of the street where somebody was cutting the grass and I didn't take my Zyrtec that day, and my whole day would be ruined because my eyes would be itchy and I'd be sneezing bad. My cholesterol was bad. My asthma was getting worse. My back pain and foot pain were there. I was at my max weight as well, and I had a family history of obesity. These are a few of the medications that I was on at the time. Regularly, just kind of, which one do I do today? Okay, maybe I'll do Pepto today. Maybe I'll do Tums today. Maybe I'll do my Lanza. All right. So, In 2015, I did a Daniel fast based on the prophet Daniel in the Bible. He did a 21-day fast from animal products, from added sweeteners. He did one from meats and choice foods. So I did. My church was doing a Daniel fast, and so I did it mainly because my career path. I was in my past life. I did global health and HIV work, and pediatric HIV, which is we essentially eradicated peds HIV. Yay, this is great for public health. Fantastic. Not good for job security, though. So I had to find something else to do. So I had to pray about my next career path. And I did the fast, and 5 days into it, I'm bored with the same foods over and over again. I'm just like screaming. I can't take 5 days in a row of black beans, brown rice, mixed vegetables. Like, what else is there to eat? I don't know. Then I was reminded, is this a spiritual fast or a lifestyle change? I'm like, okay, all right, spiritual fast. And I thought about it. Wait a minute. You know what? There are people out there who are starving to death. And I've never missed a meal based on not having enough food. I mean, I missed meals because I've been too busy, but never because I didn't have enough food. So Lord, forgive me for being ungrateful. Let me go ahead and finish my fast and stay strong in this. My constipation was gone in 10 days, completely gone. I had it for 10 years or more, and constipation was just completely gone in 10 days. And it hit me that I am fearfully and wonderfully made, but my lifestyle was promoting disease. So I was eating foods that promoted constipation. I was eating foods that promoted inflammation, and therefore I had inflammatory problems, and therefore I had constipation. It made sense. Like, oh my gosh, like I don't know why I didn't get that in medical school where we try to overcomplicate things. Really, it's you eat foods that promote constipation, you get constipation. You eat foods that are inflammatory, you get inflammatory disorders. It's pretty simple. And since that time, I've lost 6 inches on my waist. My allergies are all gone. My seasonal allergies are all gone. I still allergic to peanuts, unfortunately, but everything else is going away. I'm on none of those medications. My back pain and foot pain are gone. My dad did a fast. He was 82 at the time. His blood pressure dropped to 95/60 within 10 days on the fast, and he had to cut his meds down and then off within 3 weeks. Now he went back to his old lifestyle and his medications came back, but it just proves that hypertension may be a choice, right? And then he said something that was like, he said, son, everything works. Everything works, son. His potency came back. And because he started eating differently. And it's just like, oh my gosh, this is absolutely amazing. And so after my dad had his benefit, I was like, dude, this could work for everybody, not just for me. It's worked for everybody. So that's why I went into lifestyle medicine, because I really wanted to help transform Black health. And this is my before and after pictures with my daughter. And she is my why. I'm an older parent. I was 41 when she was born. And so I didn't want to be at her high school graduation and people saying, oh, your grandfather, he's so nice. And it's like, that's my dad. Your dad, he's so old. He's decrepit. I didn't want that. I wanted to be, have vitality and stuff like that. So she's my main why. So, but ultimately, I had to ask myself, what is the predictable and almost certain future of my health if I make no changes to what I'm doing? And I'm like, I'm getting worse and getting worse. Just not looking good, right? And I wasn't okay with the response. So there's nothing wrong with any type of food. There's nothing wrong with anything, okay? There's nothing wrong with my fried chicken, my pizza, my Doritos, my Swedish fish, my candy. Nothing wrong with those things, but they do lead to an outcome. And I'm free to choose whatever I want to choose, but I'm not free from the consequences of those choices. And so I want to make sure we think about, what vision do you have for your health? I see my dad now. He's 90. He doesn't have the mobility anymore, and he is just really depressed about that. If that's where you see yourself headed, then you say to yourself, is that something that I'm cool with? If the answer is no, then we got to make lifestyle changes now so we don't get to that point. Patient testimonial. I had a 52-year-old man who came to visit me. He had a new diagnosis of diabetes. Both his parents have diabetes. He loves golf, but it causes him pain. He can only go about 11 holes before he has a lot of back pain while he's doing his golf. His ankle was stiff and painful every morning. And I asked him, do you want me to help you to manage your diabetes, or do you want me to help you to reverse your diabetes? He was like, reverse, reverse, you know. And I said, man, this is not going to be a small change. It's going to be a major change. And if you want big goals, you got to make big changes. So he did a Daniel fast as well. The Daniel fast is 3 weeks duration. Nowadays, we have no animal products. So no pork, beef, poultry, seafood, eggs, cheese, milk. No processed food. So if you're going to do pasta, it has to be whole wheat pasta, not white pasta. And no breads and no added sweeteners. And so why it works is because it's low in saturated fat, it's high in fiber, and there's no added sugar. And so those things tend to be health promoting. So within 4 days, his ankle pain was gone. He'd have every day. It's gone in 4 days. Within 3 weeks, he's able to golf without pain. And so he's able to get back to doing the activities that he enjoys pain-free. He was able to do 18 holes of golf without pain. He did 5 days in a row of 18 holes of golf without pain. So he is ecstatic about this. And within 6 months, his diabetes was reversed. So when it comes down to health transformation, we understand there's a scripture that says, do not be conformed to this world, but be transformed by the renewing of your mind. And so if we keep doing what we've always done, we will keep getting what we've always gotten. And so it's important for us to understand transformation does not start on our plate. It starts in our mind. That's where transformation starts. If you think immediate gratification, and this is how I've always eaten, this is how I've always eaten, and you try to start adding new healthy stuff, it doesn't compute with your current brain, and so it's going to be a struggle. But if you say, I am healthy. Let's say come January 1st, 2025, I am healthy. That's who I am. I am fearfully, wonderfully made. I am a picture of health. Then you do healthy things. It all starts in our mind. We need to have a renewed mind towards health, towards food, towards fitness, towards stress management, and towards sleep. So now, in terms of being conformed to this world, what's going on in this world for Blacks? We have higher rates of disease and death from almost every disease, except for hip fractures and head lice. We're way down on the list on those. But other than that, almost everything. We have more advanced stages of disease at diagnosis. And it's not because we're Black. It's not just because of our genetics. It is our culture. It's our traditions. It's these social influencers of health that are affecting us more than others. It's health disparities. It's health inequities. It's these other things that are the problem. So now, what is lifestyle medicine, in case you're wondering? It's a medical specialty that uses therapeutic lifestyle interventions as a primary modality to prevent, to treat, and often reverse chronic conditions, including but not limited to cardiovascular disease, type 2 diabetes, and obesity. The 6 pillars of lifestyle medicine are predominantly whole food, plant-based eating, physical activity, stress management, adequate restorative sleep, avoidance of risky substances, and positive social connections. If we prescribe this to people, they will have better outcomes and may potentially treat or reverse their chronic disease. Now, it's got to be sufficient lifestyle changes. Now, it can't be a small change necessarily, because small changes often lead to small benefit. If you think about it, as a pediatrician, if a newborn needs some Tylenol, that dose is 50 milligrams. That is the therapeutic dose for that infant. If I give that dose 500 milligrams to that kid, it's going to be toxic for that kid. 50 milligrams is what's appropriate for a newborn, but 50 milligrams for an adult is only a 1/10 of the adult dose. And so we wonder, why don't lifestyle changes make a better difference? Because we're giving a dose that isn't supposed to be effective. So we need a dose that's going to be effective for whatever health problem that we're dealing with. Plus, if we have enough sufficient lifestyle changes, we can have other benefits of living healthy. We can have weight loss naturally. We can have fewer medications and fewer side effects of medications, less joint pain, less back pain, and a quicker recovery from other events that we do. Plus, there's a veggie Viagra effect. Hello. A veggie Viagra effect. We'll talk a little bit more about that shortly. There's actually a book out there called The Plant Power Penis. And so, of course, I had to get that book. I had to get it. And we'll talk about that shortly. So for men's health, the same diet, and this goes for anybody really, but the same diet that promotes high blood pressure and high cholesterol also promotes prostate enlargement and prostate cancer. So dairy, saturated fat, low fiber, all that is going to promote high blood pressure, high cholesterol, prostate enlargement, and prostate cancer. But also keep in mind that the treatments for high blood pressure and the treatments for prostate problems could cause erectile dysfunction. So what could help? Whole plant foods. So I'm saying an apple, not applesauce. An apple, not apple juice, right? Definitely not apple pie, or not that often at least. What also would help? Dark green leafy vegetables, especially arugula. I'd never heard of arugula until, I don't know, 6 years ago. It's probably been out here for millenniums, but I never heard of it. Arugula is the vegetable that has the highest amount of dietary nitrates, which lead to nitric oxide, which leads to opening our blood vessels. All right, so I want to include arugula in my lifestyle, open up my blood vessels to help decrease our blood pressure and help blood flow everywhere. Ground flax seeds are really helpful as well to reduce inflammation and to help with the prostate. So cancer and diet. There's a compound called IGF-1 that initiates, promotes, and spreads cancer. That compound is there. We have a lot of that when we're growing as a teenager and as a youth. But as an adult, we don't need that anymore. We don't need to grow. What's going to happen is we grow. We're either growing wider or we're growing our individual cells, i.e. cancer. Dairy, eggs, and animal products all increase your IGF-1. So eating eggs, eating less than 1 egg a day. I mean, not zero, but eating a couple of days a week of eggs can double your risk of prostate cancer progression. Eating 2.5 eggs a week, or basically an egg about every 3 days, has an 81% higher risk of dying from prostate cancer. Poultry is actually worse, having 4 times the risk of prostate cancer progression. So there was a study by Dr. Dean Ornish where he took 93 men with prostate cancer who weren't getting conventional treatment, and he randomized them into a control group and an intervention group. The control group had no extra diet or lifestyle advice. The intervention group had a plant-based diet and were walking 30 minutes a day. The control group, of course, if you don't do anything with prostate cancer gets worse, so the PSA increased. And 10% of those people who were randomized to that group needed a radical prostate removal, which of course leads to the side effects that might be incontinence, impotence, orgasmic dysfunction. But in the intervention group, the PSA dropped by 4%. Nobody needed surgery. And they looked at the genes, and there were actually 500 genes that were turned on from just eating the right foods. So it's really, this is where the epigenetics comes in. So prostate cancer, enlargement, and diet. So what improves prostate health? If you want specific things that may help, ground flax seeds. They can't be regular ground flax seeds. They have to be ground or flax meal, or you gotta chew them yourself. But if you do flax seeds whole, they'll pass through your gut undigested. So ground flax seeds, garlic and onions, vegetables in particular, and I'll talk about that shortly, and then legumes, so your plant-based proteins are helpful for prostate health. The vegetables that help the most are your cruciferous veggies. These cut the risk of cancer progression by more than half. And now, cruciferous veggies include the ones that are listed here, but there's a certain way you need to have them. So if you're going to cook these vegetables, and you can add, let's see, what's it called? Collard greens to this list too. If you're going to have them, the way that you cook them to optimize their anti-cancer, anti-inflammatory, and antioxidant properties is this. You cut them and you wait 40 minutes and then cook them. So either you buy them already cut, and buy them cut like not frozen but refrigerated. You can buy them cut already. You can buy them and then cut them yourself 2 days before you cook them, or a day before you cook them, or 2 hours before you cook them, but at least 40 minutes. That allows that when you cook it, that the enzymes are not degraded by heat. So the compounds become heat stable. So if you do that for your cruciferous vegetables, cut them, wait 40 minutes, and then cook them. So it's important to understand that getting sicker is not inevitable. Our family health history does not have to be our family health destiny. And we can lead the transformation of health in our families and communities. But it requires a paradigm shift. We can't think our old thoughts and have better outcomes. We have to think new thoughts. We got to be transformed by the renewing of our mind. You would renew your mind first, and then you have transformation. So renew your mind first. So rethink of food as a source of health or as a source of disease. And then, be mindful of this eating. Is this getting me to my goal? Make your food as colorful naturally, not like Skittles or M&Ms, but make your food as colorful naturally as possible with a variety of fruits and veggies. Many of the spices are loaded with nutritional value, especially your turmeric and curry. So turmeric is an anti-cancer, anti-inflammatory spice. It should go with black pepper. So if you're going to do turmeric, you should have black pepper with it. Garlic, basil, cilantro, ginger, all those are not just tasty, they are health promoting. And then really focus on what can I do to get the right foods in, as opposed to focusing all your focus on getting the wrong foods out. Let's add in so many of the health promoting foods that we are shrinking the size of our portions of the things that are less healthy. And then really focus on getting whole foods over processed foods. The processed foods have the good stuff taken away and they have bad stuff added. So what are some challenges of living healthy, especially for men? There's a culture of manhood, like, I gotta eat this food, I'm a man. I got, what seems to be a masculine way of eating is really unhealthy food choices. It's big portions of food, it's lots of meat, it's very little fruits and vegetables. And that the feminine way is that's feminine. No, that's healthy. That's what it is. Listen to our women, fellas. Listen to our women. There's a myth that animal protein is better for building muscle and for testosterone. That is actually a myth. And in fact, the inflammatory compounds that you have in your animal proteins will lead to poor recovery. So you want to have more plant-based protein that helps to speed up recovery. I would like to prescribe you a treatment plan that will manage, if not completely reverse, your diabetes, your hypertension, with the likely side effects of fewer medications, weight loss, improved mood, improved energy, a veggie Viagra effect, where if you think about it, even for erectile dysfunction, it isn't like we have a Viagra deficiency syndrome. It's the fact that our arteries are narrowed and we can't get blood flow to the penis. We don't have a antihypertensive deficiency syndrome. We don't have a statin deficiency syndrome. We don't have a metformin deficiency syndrome. We have an issue with our lifestyle. And if we change our lifestyle, we can have lots of benefits. We can reduce many cancers, reduce the number of medications we got to take, prolong and enhance your life. So the prescription would be to change your diet to being more plant-based, and your lifestyle being more physically active. So if you want to do it gradually, you can do it that way. I love the Daniel fast because it helps me to bring the spiritual strength to overcome these challenges. That's why I do the Daniel fast often. I do it 6 times a year. In fact, my wife and I are on the middle of a fast right now. We do them 6 times a year. We do them typically in the odd number months. So we'll do another one in September as well. So what foods promote health? Whole plant foods. So fruits, vegetables, your whole grains, not your white grains, but your whole grains, legumes, your beans, chickpeas, lentils, soy, etc. your nuts and seeds, your water, your unsweetened tea and coffee. Those tend to promote health. Because nothing's good is taken away, nothing bad is added. And I just mentioned the apples versus applesauce and apple juice. And then whole wheat pasta would have the fiber and the nutrients that were intended to be in our food. So can you guys think of small steps? If you guys want to do small steps, what small steps could you take to improve your health right now? What could you guys do?
You could start drinking water all the time and no other kind of drinks.
Yep. I'm a big proponent of adding in green tea and unsweetened green tea as well, because there's a lot of benefit to that too. But yes, actually water and you know, forget the juices and the sodas and all that other stuff. Yes, absolutely. What else?
150 minutes of exercise per week.
Oh man. Oh, if we did that, our mobility would stay strong. Plus 2 days a week of resistance exercise or strengthening, muscle strengthening exercises. Absolutely. So here's a few of them. Take the stairs more if you're able. If you're tired, you can do a quick burst of exercise to wake up instead of going straight to caffeine. To fill your plate half full with fruits or vegetables at every meal. If your plate is half full of fruits and vegetables, you will make a big difference. Drink more water and unsweetened herbal green tea. Figure out how to add more fruits and veggies into ordinary meals. So I sometimes chop in spinach in my spaghetti. So choose whole grains over refined grains. Plan better so we can reduce or prevent stress. Consider meditative practices and prayer. Purpose to walk more. Meal prep more and eat out less. Reduce processed foods and use more plant-based proteins in place of animal proteins. So food examples. If you did chili, you can still do the tomato sauce, chili powder, cumin, onions, and peppers as you ordinarily would. But instead of doing ground beef or ground turkey, you just add in more beans. You can add in diced sweet potatoes. And then I do a pasta for my chili. And so I might do a whole wheat pasta instead of the white pasta they used to do. Adding in smoothies is a great way to get in some nutrition. So frozen berries with other fruit, soy milk or almond milk, kale or spinach, and you might start off with 3/4 fruit and 1/4 vegetables, and you can increase the vegetable content over time. Add in arugula as well. Turmeric with black pepper, ginger, and ground flax seeds could go in your smoothie as well. So the vision, where there is no vision, the people perish. All right, it's so important for us to get beyond thinking about today. So I want you to ponder for 10 seconds. What is the vision for your health? What do you see for yourself 2 years from now, 10 years from now for your health? What would you want for your health? What is the vision for your health of your family? What do you want for the health of your family?
I would, for my vision, it would be to try to freeze the aging process. In other words, all of these things that come with old age, if I could freeze them where
Right.
they are.
Right. Yeah. And there's a book out there. So one of the things that helped me with my lifestyle changes is I read this book called How Not to Die by Dr. Michael Greger. How Not to Die. That book blew me away. I'm reading this book and I don't cuss very often, but I was reading this book like, how the F do I not know this as a doctor? How do I not know this? We've been mismanaging people for so long. Now, oh my gosh, what am I doing? Right. And so he wrote the book, How Not to Die. He wrote the book, How Not to Diet. And now he wrote a book called How Not to Age. And so Dr. Michael Greger, I got the How Not to Die book right here. So, gee. Um, So he wrote How Not to Die, How Not to Age. And so that's really, really, really important. You can reverse the aging process. I mean, you can't reverse the chronological age, but you can, increase the length of your telomeres. You can reduce the inflammation that happens and all that time. You can get your mobility back. So I think it's important for us to think about that. That's a great part. And then what legacy are you going to leave for your family? So in summary, I'm going to play a couple of videos real quick. But in summary, our lifestyle can promote disease. Our lifestyle can promote disease, or it can reverse disease. Choose ye this day which one is going to be, and take specific steps to promote health. And then be transformed in your health by the renewing of your mind towards food and physical activity. So there's two documentaries I want you guys to potentially watch. One is called The Game Changers, and it's really good about mobility and strength and things of nature. So the Game Changers documentary is one of them. You can take your camera and use that QR code for that. And then we'll move on to the next one. It's called They're Trying to Kill Us. This one's on YouTube and Tubi. I'm gonna play a bit from that. I'm gonna stop my share. I'm gonna play a little bit of a snippet from They're Trying to Kill Us. If I can find my, okay, there it is. All right. Where is my share sound, optimize video clip? All right.
It's something about being here.
Can you hear it?
Yep.
That's making Black people sick.
If we look at prostate cancer, it is about double in African American men compared to white men. If you look at colorectal cancer, it's higher in African Americans compared to whites. Cardiovascular deaths, same story. This is not due to any difference in genetic factors, because when we look in Africa, we don't see higher rates in Blacks in Africa. We do see it in the United States. It's food.
As a doctor, there's a lot of foods that I'm concerned about that my patients are eating. And I would say at the top of the list are processed meats. And those are foods like ham, bacon, hot dogs, sausage, salami, cold cuts, sandwich meats. These are really prevalent everywhere. And a lot of people don't even recognize these foods as being processed meats. These are foods that are well known and documented to increase the risk of cancer as well as heart disease and diabetes. So these are foods that really don't belong in the diet at all.
There's a direct correlation with the amount of animal food in the diet and the incidence of chronic diseases such as heart disease, cancer, stroke, high blood pressure, autoimmune problems, so forth.
There's so many studies that show that a high animal diet increases your risk for cancer. Are they still selling hot dogs?
According to the World Health Organization, looking at over 800 studies found a direct link between processed meat and cancer. It's a group 1 carcinogen, the same group as tobacco and alcohol, definitively causing cancer in humans. According to the report, 1 hot dog a day increases your risk of developing colorectal cancer by 18%. Eating 2 servings of processed meat a day, like bacon for breakfast or cold cuts for lunch, has a similar impact on risk of colorectal cancer as smoking. And yet these foods are served every single day in public schools, hospitals, prisons, and government facilities. If you were to take the lunch tray from a public school, a hospital, and prison and mix them up like a 3-cup shuffle, you wouldn't be able to tell which is which.
You know it's bad, but you gonna feed it to your child. Like, that's a baby. You love the hell out that baby. You feeding that baby something that can possibly kill him it could kill him now. It's kids with cancer. That stuff deep as a mug.
We know that red meat, beef, is related to cancer of the colon, cancer of the stomach. Smoked fish.
They're 2 times more likely to end up blind or visually impaired due to diabetes. 2.3
ribs and this and that. And it's like, okay, and that's why you lost your leg two months ago from diabetes because of that. But they don't equate one to the other.
It's rare that you go into some like Black kid's house and there isn't an uncle in the back room
with his leg cut off that you never see. It's not often that I meet someone that doesn't have it or doesn't have someone in their family that has it or someone that died from it. 1 out of 3 people is supposed to have it in the next 10 years. It's a very common thing.
African Americans are 2 times more likely to end up blind or visually impaired due to diabetes, 2.3 times more likely to lose a lower limb, and 3.5 times more likely to end up on dialysis than whites because of diabetes complications.
Obviously, once you end up with a leg amputation or kidney failure or heart disease from your diabetes, you're going to lose an average of 17 years of life. When I learned that I was diabetic, type 2 diabetic, was losing my vision in my left eye, I had permanent nerve damage in my hands and feet. My right thigh had serious nerve damage. I had an ulcer. Cholesterol was through the roof. High blood pressure. The black package. We know the song. Yeah.
And the complications of diabetes are really awful, any one of which would be awful. But
I'm not sure what's happening.
People suffering from type 2 diabetes remove animal products from their diet and replace them with whole fruits and vegetables, they were able to reverse the disease.
when you go on a whole foods plant-based diet, your body becomes more insulin sensitive. You can reverse type 2 diabetes. You need less and less insulin or other drugs like that. And under your doctor's supervision, most people can reduce or oftentimes get off of insulin altogether.
About 80% of our type 2 diabetics will be able to achieve normal blood sugar levels without the use of medication. They can re-establish health and maintain health.
3 weeks, my vision totally cleared up. In 3 months, the ulcer went away, my nerve damage went away, my cholesterol went from a 217 to a 57, my A1C went from a 17 down to a 5.7, a pre-diabetic level. No medicine. All food, healthy food, good food, and it was the realization, it was an aha moment that it was not my DNA, it was my dinner.
Untreated diabetes also causes heart disease. Cardiovascular disease is still the #1 killer, despite all of the research, despite all the procedures and all of the information that's been out about cardiovascular disease.
So cardiovascular disease, combination of heart attacks and strokes caused by stiffening of the arteries, atherosclerosis, which is caused by the standard American diet and lifestyle.
In heart disease, there are atherosclerotic plaques in the arteries.
Plaque refers to the buildup of cholesterol particles and other inflammatory particles inside of our blood vessels. So not only is the blood flow blocked as that plaque grows inside the blood vessel, but the plaque itself can rupture.
One of the bumps breaks open, that triggers a blood clot. That's all it takes to stop the blood flow through that artery. And everything downstream gets no blood flow, no oxygen. The heart muscle there dies. If this happens in your brain, the part of the brain dies.
That's still the #1 killer and what we should be really concentrating on, because for some reason we're not doing better with that. And it's probably one of the easier diseases to treat. All these diseases are symptoms. When your blood pressure goes up high, it's not, okay, the disease is high blood pressure. It's a symptom. Your body is trying to tell you, there's something that's not right here.
High blood pressure, as we've talked about, is one of the leading contributing causes of death and disability. It's so ubiquitous that the majority of people, by the time they reach 65, have high blood pressure, and it's a preventable and treatable illness. So wait a second, if most of us over age 60 have high blood pressure, maybe it's not a disease, more just a natural inevitable consequence of aging. But no, we've known for nearly a century now. 2 years at this Royal Kenyan Hospital, 1,800 patients were admitted in one study. How many cases of high blood pressure did they find? 0. Wow, they must have low rates of heart disease. No, they had no rates of heart disease. Not a single case of arteriosclerosis was found. So we've known that there is not epidemic heart disease among people that are centering their diets around plants, but you don't know its cause and effect until you put it to the test. When researchers took people with heart disease, put them on the kind of plant-based diet followed by populations that did not get epidemic heart disease, their hope was, say, maybe we could slow the disease down a little bit, maybe even stop it. But instead, something miraculous happened. As soon as people stopped eating artery clogging diets, their bodies are able to start dissolving some of that plaque away, opening up arteries without drugs, without surgery. Look, if that's all a plant-based diet could do, reverse the #1 killer of men and women, shouldn't that be the default diet until proven otherwise? And the fact that it can also be so effective in preventing, arresting, or reversing other leading killers like type 2 diabetes and
All right, so let me go to my presentation.
World's major killer diseases. Why aren't we hearing more doctors talk about it?
In medical school, nutrition has
And so,
really been overlooked. Now, that would have been defensible if it weren't for the fact that nutrition is the single.
Okay. All right. So, let's see. Screen sharing is paused. Let me bring back this. All right. So thank you guys. May the fork be with you. Here are some ways to reach out to me or to see me or follow me on Facebook, Instagram, YouTube, etc. And we're doing it at Down Fast now. We will be doing another one in September as well. If you're willing to join. The reason why we do it so often is that we've had people who have said, I had one person, two people actually, about my home church in Indianapolis. I'm gonna get you the next fast. I'm gonna do the next fast with you. And they had opportunity to do the fast, and they didn't make it to the next fast. They died before they got to the next fast. And I don't know, would this have saved them? Maybe, maybe not. I don't know. But we think we have time, and we don't know if we have time or not. And so the time really is now to be able to do the right thing and to make some significant changes to improve our health, to be there for our people. When George Floyd died and people were marching because of his death, there are people who couldn't march because they didn't have the physical ability to do it. And Dr. Callender has let me know about how awesome the people in this group are. We need you here on this planet. We need you here as healthy as possible, right? To be able to continue to impart your wisdom, your knowledge, your experiences on the people who are here now, so that we can learn from each of you and we can benefit from you, and that you won't be in the hospital all the time or be suffering from issues, and your family and yourself could get much better. And it really is really focusing on putting in the right foods. Like my mentality is, if this is who we are, we are healthy and we have some abnormal input, it's not surprising that we have an abnormal output. Now, we're going to try to put medications in here to try and stop the effects of abnormal input, but really it's taking that input and making it healthier so we can have a normal and healthy output. Thank you guys for your attention. Any questions, comments?
Dr. Bowman, I think this may be one of the most important presentations of our 49 years of existence. So thank you very much. And the floor is now open for questions.
This is not only the most important, but it's one of the best presentations that we've had. So interesting. And I want to personally thank you for coming, Dr. Bowman.
Thank you. Thank you. Thank you.
Thank you.
Dr. Bowman, I am so glad that you're on this session, because
Mark is first.
See, I don't have any credentials, and so like nobody listens to me, but you say it and it's gold. So thank you very much.
Mark, you're next.
Yeah, I have a comment. The information was great. I can't take anything away from it. It's much needed. In studying communications, I think the message we need to get to our people is to target behavior now. Because I've seen how information campaigns, they do good to inform people, but I've seen people's behavior still stay the same. For instance, smoking, we've known for decades now that smoking is bad, but there's some people who are, it's become an addictive, it's become an addiction for a lot of people. And so they still continue to do it. So I feel like food has become that for us as well. It has become this addiction where you can tell people how bad this is, but they'll still find themselves going to McDonald's and things like that. I really want to help I want to help this initiative, this cause, to be on the side of, you know, along with information, helping to somehow target behaviors and attitudes
Yeah.
and beliefs by it, because I think that's going to be our real battle right there, if that makes sense.
Yeah, it's funny to say that. So my wife is a health coach extraordinaire. I'm really good at the what and the why. She's a whole lot better at the how than I am. She's really good at motivational interviewing to get people to have a completely different thought process. Like, okay, so we had one person who was eating pizza a lot, and she didn't want to give up her pizza. She didn't want to give up her pizza, and then she started digging. Like, so what is it about pizza that And she said, well, it tastes good. What else is there about pizza? What else drives you about pizza? And she's like, well, now I think about it. When I was younger, I used to have pizza with my dad, and that was our Friday night thing. And I'm kind of keeping that memory alive by doing the pizza every Friday night. And so she got down to oh, that's where it's coming from. Well, is there another way to honor your father, right? That may be supportive of your health as opposed to detrimental to your health. And it's like, oh, wow. Well, I guess now that way, I hadn't thought of it that way, right? If you guys watch that video, please watch they're trying to kill us. I now, and Dr. Callender, you may not know this, and don't tell Howard University about this. But I now, so I used to do a nutrition lecture for all the medical students for the past 3-4 years. Everybody comes, actually probably longer than that, maybe about 5 years. I've given nutrition lectures to every person. So at least clinically, they're exposed to some of these things that we just talked about today. But when I saw this video, the They're Trying to Kill Us documentary, the last 2 times I had students come through, instead of giving a lecture, I had us watch the video. And they're like, wow, wow. I kept asking them, like, yo, this is amazing. For Black people, we're at Howard. For Black people, we've got to make these changes. And oh my gosh, it's not just it's not a medical thing. It really is a higher than us thing. It really is that people are conspiring to kill us and to make us sick. And you are at Howard University. You should want to know this, and nobody's watching the video. Nobody watched it. So I'm like, oh, come on. I know you're medical students, you're busy, but you guys watch Netflix. You guys watch other stuff. Like, I know you got to relax. At some point in time, watch this video. They weren't watching it. So you know what? I'm gonna make them watch it. And they have absolutely loved it. And we have discussions about it afterwards. And understanding that there's so many things above us, that the politics of food drives why they're pushing cheese crusted, what do you call it, cheese, the cheese crust pizza. Why are they pushing that? Because the government wants us to eat more of this stuff. They want us to be sick. So really, this is our Wakanda forever moment to say, man, I'm not dealing with your cheese and your white carbs that you're trying to push on me. I'm not trying to deal with your processed meats you're trying to push on me. I'm not dealing with that. And so this could be a way for us to really think about it from a social justice perspective too. And I mean, if you think about it, we have an epidemic of obesity and obesity and overweight in this country. Does anybody know 2 major factors that we need to do? We got to, I would say eat less, but have fewer calories and expend more calories. I mean, that's pretty much it. It's pretty simple. But yet, like Mike said, the behaviors haven't necessarily changed, and it's because, one, it's an addiction. I used to travel. I used to go to Africa, and I'd come back from Africa, and I went there for 4 months at a time. And so I'd get used to their way of living and then come back to the US, and I'd come back with fresh new lenses about America. And it's like, oh my God, there's no way I can stay skinny here. There's no way. I gotta get big here, because everywhere you go, the Kit Kats are calling your name, and the Twizzlers right there at the checkout aisle, and everywhere you go, it's just like, French fries and this and pizza. I mean, it's just, you're bombarded constantly. it is hard. It takes effort. That for me, that's why I said I gotta do it spiritually, because in my flesh, I'm going to succumb. But with my spirit, I can do all things through Christ who strengthens me. That's my personal view. But that's just how I feel. I need that spiritual help. And that's why for our group, we look at things being transformed by the renewing of our mind, because it's not just here's a list of to-dos. It really is a mindset.
Okay, in order, so many people have questions. Let's start with Dr. Perez, then go to Carol, and then Darryl Armistead.
Outstanding. Jesus is smiling. Outstanding.
Thank you. Thank you so much. I appreciate it. I worked hard to get to this point, and last night I gotta do this. I gotta do this. I gotta make it good. I gotta make it real good. So thank you so much for your feedback. I appreciate it. Dr. Callender's on it. I gotta make it good. I gotta make it good. Dr. Callender, he is a legend at Howard University and in the country.
Darryl,
you're on mute still.
Darryl.
Maybe his hand is still up.
Carol. All right. I thank you so much. It's thinking about renewing of your mind. What we as Blacks, we pride ourselves on our soul food, which kills us. But we have to say what our parents did, actually, the food that we were served, those are the things from slavery. They did try to kill us. And I'm going to look at that. What's the difference and a renewing of our mind? Because, I was just talking to my husband, he was thinking about the food that he was served in his childhood because his mother served it to him. But if we start thinking about the food that our parents served us wasn't really good for us at all. And that's a mind-boggling thing because we never want to think that our parents served us anything wrong.
Mm-hmm.
I want to know what's the difference between the Daniel fast and how come you're not eating that 12 months a year? Or what do you add in between?
Good question. Great questions. And okay, let me go to your first point before I forget it. Oh my gosh. I already lost your first point.
Daniel.
So that's
the foods that our parents served us.
Yes, thank you. It's like when we are, when I was reading this book, the How Not to Die book, and I was reading this, and I'm like, oh my gosh, I'm a doctor. I did what I thought I knew was best, and it turned out that it wasn't best. But I didn't know that it wasn't best. In the Western medical system, yes, what is great is if I get sick anywhere in the world, let me get acutely sick in America. This is the best place to be for acute sickness. For chronic stuff, we are horrible. But for acute stuff, man, this is the best place to be, right? So we didn't know as doctors that what I was doing was just perpetuating the problem by not talking about and addressing your. It's like if you have an overflowing sink, we will have we'll train our residents and doctors to get great mops to mop up the floor, right? And we keep mopping the floor, and then the pharmaceutical industry will give us these rolls of paper towels every day the rest of our lives. And nobody's looking at the tap, turning the tap down or off, and nobody's looking at how we get the clog out of the pipes. And so that's how we got to get to it. We got to get to the pipes. We got to turn down the faucet. And then, yes, we got things we got to clean up. We're going to have to clean up some stuff. But we can't just look at, oh my God, we got this overflowing diseases that are coming in. It's a mindset. And so now for my child, I'll have almost all her snacks be fruit, right? As opposed to being, she's a lot different in my house than she does in her mom's house. And I will, I still serve her, she'll get some chicken once every 2 weeks in my house. I don't bring in any raw meats to cook. So if she's going to do it, she get that one every other day of some chicken, but she gets a ton of vegetables in my house. She gets plant-based foods in my house. And so that is, the part one of your question. Part two is, so there is a couple things about the Daniel fast that are different than the way I do. So I am plant-based, I would say year round. I am predominantly whole food plant-based, predominantly year round. And so for me, it is, I do this often for other people, right? So that they can actually get this breakthrough. If I tell you, all right, we're gonna not have any animal products, any white carbs, any sugar for the rest of your life. They're like, oh, hey, ho, ho, oh, hey. Hey, let's not do it for 3 weeks. I can do that. I'll do that for 3 weeks. Sure, I can try that for 3 weeks. And then that's what pulls people in. And then you stay. So we do prayer calls every day, every weekday of the year. So every weekday, it's not a holiday. So we keep people in community throughout the year, and we encourage and inspire people to eat more anti-inflammatory, more high antioxidant foods, which typically are going to be more whole plant foods throughout the year. People come up with different things that come up. I went to a who was it? Somebody went to a banquet, and she asked for a vegan meal if they had it, and they brought out this meal that was phenomenal, and that led to conversations at the table. People are like, "Oh my gosh, that looks really nice." Da 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 da. Why did you choose to eat that? And then led to her saying, "Hey, I'm with this group, Lifestyle Med Revolution, and we do blah 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 blah," and so I can draw people in. And so we don't do the Daniel fast 100% of the time. It's tough. It is not easy. But like for me, because of the Daniel fast, I'm now off of sugar. I don't add sugar to my tea. I don't add sugar to. I was if I had a coffee mug of tea, an 8-ounce coffee mug of tea, I would have 4 to 5 teaspoons of sugar in my tea in the past. And I saw people who had unsweetened tea. I'm like, oh God, I could never do that. Never do unsweetened tea, ever. And then I did a Daniel fast, and I said, okay, Lord, I need your help to get over this sugar thing on my tea. And I said, I need you to help me. And I got this epiphany. I've been doing the wrong comparison. I need to be renewed in my mind. So instead of comparing this unsweetened tea to extra sweet tea and saying, I'm missing the sugar, oh, this is not good. No. Let me compare this unsweetened tea that's maybe a mango, papaya flavored herbal tea to water. And do I want the mango flavored water or water? I'm like, oh, well, I want the mango flavored water. And instantaneously, I was off of sugar. I was like, oh my gosh, I thought it was going to take me years to get off of sugar. I just had to be transformed in my mind that what I'm drinking now is just flavored water. That's all it is. It's not unsweetened tea. Like I need to have sweetener, right? So it helps us to, and there are people who I know. There's a couple, married, 2 females married to each other, who have had a tremendous change in their health because they do the Daniel fast, or they do a Daniel fast like living, whole food plant-based living almost all the time. The one woman, she's lost 60 pounds in a year and a half. Her fatty liver disease is reversing. That's my phone. Her fatty liver disease is reversing. Her GI system is better. She was having sweating and all kinds of problems. All that's gone. Her wife is now 74. She had rheumatoid arthritis, and she was seeing her rheumatologist. She is discharged from her rheumatologist because they're like, you don't have any more inflammation. You're good. Discharged from a rheumatologist. And then she also, when it was needing a knee replacement surgery, and they canceled her surgery because she didn't have any more pain. She didn't get new meniscus. Her inflammation was the problem, and all of a sudden, 7 things went away. So they're so like I don't have to really sell them anymore on this, but they still do the fast to help support other people. But if I tell people, and even for me, if somebody that said, David, you can have all your constipation go away and your allergy can go away and your asthma get better, your back pain get better. All you got to do is go whole food plant-based. I'd be like, yeah, I'm not facing that. I ain't doing that. That's ridiculous. I can't, I'll never do that. But I did the fast, spiritually speaking, and it had a tremendous benefit quickly. And I knew it was only for 3 weeks, but I didn't recognize that 3 weeks not only changed my own health, it changed my career and changed the way I deal with my whole family. I got 3 plant-based nieces now. It changed my whole family. I'm now, my wife and I are plant-based. And so I didn't recognize that doing these small things would make that much of a difference. Just 3 weeks. So it's more of a 3-week trial and to bring the spirituality in, because my flesh, if I'm walking down the aisle to get some nuts, that candy is calling my name. Ooh, David, don't you want Twizzlers? Don't you want Swedish fish? Don't you want some jelly beans? And I'm like, I can't do it. Oh, no, hold on. No, I can do all things through Christ. I can walk past this aisle and get down to the nuts and get the nuts only. But in my flesh, I can't do it.
Darryl, Armistead.
I think it's still on.
Yeah, I got a question. My question is, okay, when it comes to transform mind, like say, for me, there's no peer pressure. There's nothing that can take me away from being Daniel Fast 365. So it doesn't. If I'm with people, like say yesterday, I was at a regular restaurant. They didn't have any. They had no vegan option or veggie options on the menu. So I got the vegetable medley. I told them it had to be prepared in olive oil, no butter. Uh, I would think that you and your wife are pretty much transformed minds where nothing is going to sway you from your vision.
Yeah.
Now, there's a lot of people that I know are plant-based, but they don't have a transformed mind. And so they don't really understand completely the benefits of why they're on that journey. And so, it's so easy to backslide when you don't have a transformed mind. And the hardest thing is like at my age, I'm 75, and I'm stubborn. So that's a hell of a combination. Well, I feel like more like not that I'm stubborn, but I'm free. I'm free to do exactly what I want. But when I think back, the hardest time in my life to be free was when you're a kid. So your daughter, your daughter is does she have the transformed mind that's unshakable? Because I
Yeah.
know that a lot of us are grandparents, or we've got nieces or nephews, and we're of the mindset where we're just going to let them be kids. And if they make these decisions, they'll make them when they get to be our age, when it's probably too late. But how's your daughter doing?
If you think about it. So cancer, I meant to say this. I didn't say this. I think I meant to say it in terms of the fruit fly analogy. So cancer is something that when you get diagnosed with cancer, it's not as if you were healthy last month and today you're unhealthy. You've been unhealthy for years. Your body has allowed this to happen for years, right? And so that is something that is really important to think about. You allowed your environments that you allowed cancer to grow. Either if you walk into a room and you see some trash on the floor, you have three options. One is you pick it up and put it away. 2, you ignore it. 3, you're like, well, this is a kind of place that's dirty, so I'll add more to it. I'll add more trash to it. Instead of taking my trash and taking it way down the street and getting the trash can, well, there's trash here anyway. I'll throw trash on the ground. And so that's how our bodies are. Is our bodies hospitable to disease, especially cancer, because cancer is very slow growing. And so it's really important for us to think to ourselves that can actually happen with our cancer. So it's not like, well, once I get older, once I get this diagnosis, then I'll change. It might be spread by that time. It might be like threatening by that time, it may be too late. But if I do it, the earlier I do it, the better. So I counted one day with my daughter how many fruits and vegetables we had on a particular day, and she had 8 fruits and vegetables in one day. And she was what, 8, 9, 10 at the time. And so even when so her mom eats completely different than I do, and so it's a whole different story. Her taste buds have never transformed. Her mind is at least now open to trying all the foods that we serve, and then she's like, I don't like it. I'll try it, but I won't like it. And so we'll have other plant-based options for her typically as a treat. So like I'm not the type of person that feels like 100% of the time I have to always be living this way 100% of the time. You know, if you say once a month I'm going to have a family dinner, I'm going to enjoy blah 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 blah. That's okay if you think you can do that without slipping. Some people, once you do that, you're going to slip and fall, and then you're right back to your old ways. Um, so, so I allow her to have the chicken once, or I guess twice a month in my house. And that's it. Other than that, she doesn't get any animal-based foods. And so everything else is plant-based. And like you said, so there are unhealthy ways to go plant-based, right? There are highly, highly processed plant foods that are not health promoting. They are just as bad as animal products. So it is very important to keep that in mind too, that it's not just not eating animal products, it really is eating more whole plant foods. The refined, the refined burgers and highly processed plant foods aren't necessary. They're good for the environment. They're good for animal rights and animal health, and good for the planet, global warming, animal cruelty, if those things are important to you, but they're not necessarily good for human health. And so what's good for human health is whole plant foods at the majority of your meals, and if not all of your meals.
Sylvia, you have a question?
Yes, Dr. Bowman, excellent presentation and very convicting too. You talked about some spices, turmeric, black pepper, and flaxseed. There's been a big push for chia seeds. Is that part, or would that be part of a spice that you would recommend to incorporate in your diet?
Yeah, so here's what I do. I'll tell you I'll tell you guys how I live. All right. So I'll eat oatmeal probably 5 days a week. And my oatmeal will have, that's a whole grain. I put chia seeds in my oatmeal because I want the omega-3s. And I put in quinoa in my oatmeal as well to add the protein for it. I'll add walnuts and blueberries. And then I'll sweeten it with dates, a date paste. So I'll take dates that have no pits in them. I'll put some boiling hot water on it and blend it. And then that's my sweetener. And it's a whole food. It's like a blending raisins essentially. And so I add that to my oatmeal as a sweetener. So it's a natural sweetener as opposed to honey or brown sugar or something like that. And then I might do a smoothie, and I'll do soy milk. I'll do you tell the recipe I gave earlier. And then for lunch and dinner, typically it'll be leftovers or food that we cook that may have curry chickpeas instead of curry chicken. And I do it brown rice instead of white rice. And so those would be kind of things that I'll do for my meals. But I do chia seeds, and then my smoothie would have the ground flax seeds. So I'm getting the flax seeds, I'm getting the chia seeds. To me, it's not an either or, it's a both and for me.
Oh, okay.
It's a great question.
Okay. Thank you.
Ms. Brooks, you had a question?
Yes, thank you. I wanted to say that I stopped smoking after 40 years. And the only reason I could do that was because of I got the medicine. But what helped was it took it out of my head. Cigarettes, you can take it out of the blood and everything, but it was more in my head. Once I was free of the nicotine and my head got a chance to clear, then it was easy to stop, and I haven't had a relapse or anything. My question is, I've been eating better. I have diabetes and I'm obese. I gained 50 pounds when I stopped smoking.
Right.
I told the doctor if I had known I was going to gain 50 pounds when I stopped smoking, I would still be smoking today. Because the 50 pounds seemed like my health got worse after I stopped smoking. But
Right.
I didn't let that, I didn't sabotage that. I kept on with that. So, I got my A1C down like 5.9. I'm trying to do the right things, but I've got a sweet tooth, and I also do not like to cook. Fast and easy. I'm a widow, and I live alone. So fast and easy. And vegetarian food ain't fast and easy. Vegetables are rough and tough, and you have to cook them. You have to cook them. So I've got to get my mind, because I love vegetables. I love all vegetables. I love arugula. I love kale is my favorite. But I love carrots. I love all of those things. But I also love chocolate. And, so I've got to get my mind, I'm thinking, listening to your presentation, which I thank you very much for, but I want tips on how to get my mind to understand the change. We always tease Darryl and say we'll come to see Darryl any other time but Thanksgiving. But Darryl is doing the right thing, but his mind is there.
Right.
I'm trying to get my mind, because I'm listening to all these things, and all the things that I love are the bad things, and I want to stop them just like I stopped the cigarettes. But I have to get it into my mind. Having it in my heart and knowing it's the right thing is not enough.
Mm-hmm. Right. So I would say this:
that I can get
use
my mind.
your successes. Use your successes that you used. There's an amount of discipline and strength that you used to be able to stop smoking. That now the difference between stopping smoking and stopping eating it, or eating differently, is you don't have to smoke, but you got to eat. Right. So I get that there's a difference. Right. We all have to eat something. Right. We'll die if we don't eat something. If you don't have cigarettes, let's say one of my analogies I always use, if you got transported somehow to North Dakota and there were no cigarettes there, no McDonald's, no chocolate, no this, no that, and there was just nothing there besides whole plant foods, would you die? And be like, it'd be a struggle.
Leave.
You what?
I would be at the airport trying to leave.
But you wouldn't die, right? You figure it out, right? And you figured it out for cigarettes. And I want you to use that type of that tenacity that you used for that, and apply that to your food and say, all right, now there's nothing wrong with anything. And like if you did dark chocolate, that would be there are health benefits to dark chocolate. There's some health benefits to dark chocolate. Now the problem is how much sugar is going to be involved in it too, right? And so if you did dark chocolate chips and put that in something, you might be able to have some benefit because you've used other things with fiber or whatever. So it really takes that transformation of the mind to say, for instance, for diabetes, we don't really understand diabetes and medicine the way we should. The way we should understand diabetes is not a disease of sugar. Sugar is the effect. Fat is the cause. So it's the fat that we wear and the saturated fat that we eat that lead to insulin resistance, and then the blood sugar builds up in our blood vessel. So I use the analogy of if you're down a hallway, each room is a cell, and insulin is the key to open up these rooms, and blood sugar is in the hallway. You got the insulin, it's trying to open up the lock to open the door, but the door is shoved shut. Something is resisting the effect of the door opening. It's resisting the effect of insulin. And that's because inside that room is a whole lot of fat. It's the saturated fat that we eat, and it is the fat that we wear. And if we were to change that and transform that, all of a sudden the saturated fat leaves out of our bodies, or the weight leaves out of our bodies. The insulin now works to open the door, our blood sugars drop. So the answer for diabetes is whole plant foods, high fiber foods, exercise, and minimizing the animal products and the coconut oil, coconut milk, dairy, etc. So those are the key. But you never know that because we just say, oh my God, the blood sugar is high. Oh my God, we got to fix the blood sugar. Here's some medications for this, here's medications for the blood sugar, medications. We never say, why is the blood sugar high? So let's get down to the why you have blood sugar that's being high. It's because of the fat that we wear and the saturated fat that we eat. So just as you use your mentality to get rid of your cigarettes, you can use the same mentality to focus on not losing weight. It is on, I'm going to eat for health. What is health promoting for me? And there's nothing wrong with what you're doing. There's nothing wrong. And what you're doing is leading to weight gain and etc. So there's nothing wrong with it. I don't want you to feel any shame, any blame, any mental stress about it. But what you told me, it's not working for you. So if it's not working for you, then all right, then what can we do that's going to work for you? For me, I'm a sugar fanatic, so I eat a lot of fruit, right? Fruit is sweet. Now that I stopped sugar, fruit is sweet to me. When I'm taking a lot of sugar-containing foods, fruit isn't as sweet. Our taste buds change, right? And so I implore you and others who want to make lifestyle changes to say, all right, the Brooks of January 1st, 2025 is, I don't know, 25 pounds down. She is healthy. That's who she is at her core. She is healthy, whatever that looks like. She is pulling you today. She is making the decision for what you eat today. The you of today wants immediate gratification and wants what it wants right now. I don't care about nothing else. I want what I want when I want. And again, nothing wrong with that, but there is a predictable and almost certain future of that. And that is that you will have continued worse health over time and continue with worse weight over time. So let the healthy you say, I am healthy, it's who I am. She's making a decision today. So what would, and I actually use an alter ego. So at times. So what would you can use, you can call yourself Beyonce if you want to. Let's call yourself Beyonce, right? So what would Beyonce do right now that's going to lead her to be healthy in the future? And you can get full on fruits and vegetables. And by getting full on fruits and vegetables, I'm not saying eat less. I'm not saying eat less. If you eat the right foods, you can eat as much as you want and you won't gain weight because it's high fiber full, it's low calorie, et cetera, et cetera. People, oh, well, fruit is high calorie. I don't say fruit is high calorie. Fruit is not high calorie. Fruit is high calorie compared to vegetables, but it's not high calorie compared to cake. So, right. So it's all relative. So get full on fruits and vegetables and have your meal be stuffed with those things so much that you don't have space to have the other things.
Okay. All right.
And
I'm going to work with the doctor. Thank you very much for your encouragement.
You're welcome. You're welcome.
Well, it looks like you've answered all the questions. Now time is for behavior change. And so I can't thank you enough for a splendid presentation. And I'm not going to tell Howard how you're transforming the lives of our medical students, but it's one of the best things you could have ever done and continue to do so.
Thank you. Thank you. Thank you. Don't tell them how. Just tell them that I am. Don't tell them how. Yes. Tell them I'm doing it, but not how.
Where are you from?
I'm from Indianapolis originally.
What high
Indianapolis,
school?
North Central.
Oh, okay. I went to Shortridge.
Did you? How old are you?
Oh, shoot.
He's 76.
So my mom went to Addicts.
Okay, so did my mother.
Yeah, so I wasn't sure, my mom finished Addicts in the 50s. I think 54, I think.
Okay.
So yeah,
I finished Shortridge in 66. My brother went to Shortridge too, Darryl.
Shortridge 67.
Armistead. Okay, wow. Look
And
at
he was
that.
a class president.
I can tell. I'm not surprised. Not surprised at all.
What year did you finish Central?
89.
Oh, okay.
89. And I've been out here. I went back to medical school in Indiana, and I've been out here ever since, for the most part, except for the 2 years I spent in Africa.
Which school in Indiana? IU?
IU School of Medicine.
Oh, okay.
Yeah.
I went to
I
IU.
went to Howard undergrad. You went to where?
I went to IU.
Okay.
3 of us went to IU. My husband and my brother, all 3 of us went to Indiana University.
Got it. Yeah. My sister did as well. I avoided. I wanted to leave Indiana so badly that I was trying to get out bad, and so I came to Howard. Loved Howard undergrad, and but I ran back. I hated DC. DC was murder capital at the time. I hated it. I can't take it. The urban life is too much for me. Let me go back to my suburbs. And then I hated that, and I came back to DC. So.
Did you have cultural shock in DC like I did?
Oh, absolutely. Absolutely.
When I came from Indianapolis, I was going, wow, Black people.
Black people, especially at Howard, Black people who are peaceful. What? That was amazing. But yeah, being in Chalk City was amazing. I mean, even now, I work at Howard and I live in Prince George's County. So sometimes I go back home to Indianapolis and I'm like,